Good morning, everyone. My name is Amy Gill, your pharmacist that cares. So, today, obviously, I'm coming to you from somewhere very different. I'm coming to you from my pool. So, why in the world am I outside in the pool? Because today we are going to talk about vitamin D. And that is a big thing. I get asked a lot of questions about that at the pharmacy. So let's talk about vitamin D and why the sun is so important. So, how long do you actually need to be in the sun to get a good dose of vitamin D? Anywhere from 10 to 30 minutes of direct sun exposure will give you the vitamin D you need daily. Now, it depends what time of day you're coming out, and that's why there's such a wide range of 10 to 30 minutes. Because if it's going to be the high peak time of the day, then you're not going to need much sun at all to get that. So, what happens when you get that? That was 10 to 30 minutes, that's going to ensure the vitamin D production. So super important. And it's more fun to be out in the sun and get the vitamin D than to take those supplements. So how does this work? The sunlight actually hits your skin, and then the skin converts the UV radiation to vitamin D. Now, you can get vitamin D from foods as well, such as fish, egg yolks, fortified milk, cereal, orange juice, and of course, the supplements that everybody comes and talks about at the pharmacy. Now, everybody have talked about this before about different vitamins and what are water soluble and what are fat soluble vitamins. So, vitamin D is a fat soluble vitamin, which means you can't actually get too much of it. But can you get too much from the sunlight? No. You really can't get overexposure. You can get a sunburn and a whole bunch of other things from being on the sun too long, but you really cannot overdose on vitamin D just from sunlight alone. So, low vitamin D, what are you going to be looking for signs of low vitamin D? Muscle pain, bone pain, muscle weakness, increased sensitivity to pain overall. If anybody said there's like pins and needles in your hands and your feet, now not when you fall asleep, right? Like when you say your hands and feet fall asleep, but if this is something that occurs more frequently, then that's an issue. So those are things that if those things do occur and they continue to occur daily, it's time to go get some blood work and see where you fall. Health issues that can be caused by low vitamin D: brittle bones, so a lot easier to break your bones; muscle weakness, which is a sign of, like I said, low vitamin D anyway. So, vitamin D helps the calcium and the phosphorus to be absorbed by your body. And you need those things for bone health. So, that is why it is key. When you go buy a calcium supplement over the counter, you're probably going to see it has vitamin D in it because you have to have adequate vitamin D for the absorption of the calcium and the phosphorus. So, what causes all of this? What causes the low vitamin D? Lots of factors can cause low vitamin D. Not enough sunlight, darker skin pigment. So, if you have a darker skin pigment, you very likely have lower levels of vitamin D. Malnutrition, kidney or liver failure, because it prevents the adequate processing of the vitamin D. Certain types of cancers. There are so many things that can actually factor into this, and that's why it's important to see if you're experiencing a lot of these low vitamin D symptoms that you do get the regular blood work. Low vitamin D can also play a role in certain types of other health conditions such as fibromyalgia, MS, chronic fatigue syndrome, even depression if your vitamin D is too low. Now, can you get too much vitamin D? Yes, you can if you are taking too high of supplements, because, like I said, it is a fat soluble vitamin. Unlike vitamin B, which helps with your energy and so many other things, we'll get into that next time. But if you take too much vitamin B, B as in boy, and your body cannot absorb that, what's going to happen? You're just going to void that out. But with vitamin D, that doesn't happen. So you can get too much. If you have too much vitamin D in your system, nausea and vomiting, confusion, pain, so similar to even having too low, but constant pain, loss of appetite, dehydration, excessive urination, that can lead to dehydration, excessive thirst, those three all kind of tie together, kidney stones, irregular heart rhythms. And if these things continue for a long time, especially the irregular heart rhythms and some other things, this can actually ultimately lead to death if this is unchecked and these levels are too high for an excessive amount of time. The usual intake of vitamin D is around 600 international units per day. There's something called upper intake level, and that is 4,000 international units per day. If you're going to take at those upper limits, you really need to be under a doctor's care. Don't just go to the pharmacy or any sort of supermarket you can buy vitamin D supplements. Don't just go grab those off the shelf. That is not what you want to do without talking to somebody. Some medications can actually interfere with the absorption of vitamin D, while other medications can increase your levels of vitamin D. So it is so important to have those conversations. Don't just randomly go and pick high doses without talking to your doctor or pharmacist and talking to them about when you need blood work, how often you need this blood work to maintain that. There are prescriptions that we actually do for vitamin D people take once a month. But again, being a prescription, that is under the doctor's care because these people have very low vitamin D, and even the over the counter daily supplements are not enough for them, even with the sun, even with the foods I was talking about. So this is so important that you don't just randomly take these supplements, being a fat soluble vitamin. So I'm going to implore you, if these are something that you've seen, these low symptoms, these side effects that you're seeing, if you see any of these things, if you're not getting enough sun, if you do have darker skin pigmentation, let's have a conversation. Let's talk about this. Let's talk about how often you should get your blood work done. Let's talk about the medications you're on to see if they're actually causing poor vitamin D absorption or if they're increasing your levels, because again, that can be dangerous as well. So I hope you've enjoyed this change of scenery. It is really nice outside. I think I'm going to stay in the pool after I shut this off. So, but let's really do have a conversation. If you know of anybody that fits into these categories, let's chat. My name is Amy Gill, your pharmacist that cares.